Hello, welcome to my live. Where are you watching from? I'm streaming from Kenya. I'm streaming from Kenya, sir. Hello, where are you watching from? Where are you watching from? I'm streaming from Kenya. Okay, before we start, let us have a word of prayer. Our Heavenly Father, thank you so much for this day. Thank you so much for this for you have brought us. We give you the glory, my Father, the Creator of heaven and earth. We give the glory to the Son of the Holy, to the Son of the Creator, Jesus Christ, Son of the Most High God. We give thanks and glory to our Holy Spirit, our guider and protector. Oh God the Father, we thank you and we ask you forgiveness of our sins. Bless this day, bless this life, bless everybody that will watch this live. Open their doors. In the mightiest name of King Jesus, your holy Son, I do pray and believe. Amen. Okay, guys, today I want us to talk about the male genitalia. I want us to please talk about the male genitalia. Yeah, so the male genitalia. Okay, as you know, the male genitalia organs are to produce reproductive cells and deposit them as close as possible to the female ovum. In addition, they are designed for the passage of urine. The prostate is the gland. The prostate is the gland in charge of producing fluid, swim, and where they obtain their energy and nutrients for their long journey through the uterus and fallopian tubes. Reproductive cell factory and conduit for urine elimination. Okay, seminal fluid produced by the prostate contains mainly proteins, fatty acids, and minerals. Its pH is alkaline for partial neutralization of the acidic vaginal environment. So the vaginal environment is acidic, and the seminal fluid produced by the prostate contains mainly proteins. Mainly proteins. You understand? The seminal fluid produced by the prostate contain mainly proteins. And the proteins and fatty acids and minerals. And its pH is alkaline for partial neutralization of the acidic vaginal environment. Sperm could not survive in the acidic vaginal without the seminal fluid produced by the prostate. You see? So if the sperm was produced direct to the vagina, it won't survive because the environment of the vagina is acidic. You see? There's a mosquito here that has been doing me wonders. I wanna. It has bite me. Okay. Here it is. You know, again where it has been. Here it is. It has really bite me. It has really bitten me. It has really bitten me behind. Continue. So the female genitalia is acidic in nature, and that's why the seminal fluid produced by the prostate contains mainly proteins, fatty acids, and minerals. Its pH alkaline for partial neutralization of the acidic vagina. So without the fluid, seminal fluid, the sperms could not survive in the female genitalia, the vagina, because the environment of the vagina is acidic in nature. So that's the reason for the seminal fluid produced by the prostate. In addition to a healthy diet and lifestyle, local hygiene is essential to caring for the male genitalia. It cannot be overlooked that in the male genitalia is the location of the most common type of cancer in men, prostate cancer. So prostate cancer is the most common cancer in men, which is related to meat and milk intake, you see. So if you're a fan of meat and milk, you should be keen with your hygiene, because those are the foods that promote prostate cancer. So caring for the male genitalia, slough of cells and leftover urine accumulates in the space between the foreskin and the glands. The foreskins, mostly for those who have not been circumcised, though it's rare to find in this century. forming a whitish substance called smegma. This occurs primarily in uncircumcised men, like I said. It's rarely found nowadays. Poor hygiene and the resulting accumulation of smegma under the foreskin is in uncircumcised males promote infection of the glands by bacteria and fungi known as balanitis. These infections are accompanied by bad odor, itching, pain, and irritation of the penis. You see, the glands must be washed daily. Okay, those are the for circumcision. Male circumcision is one of the oldest known surgical procedures. There is a great deal of controversy in the medical community regarding the need to routine circumcise all boys. In addition to the religious implications of circumcision, there are medical arguments that are for and against it. Advantages of circumcision: better cleansing of the glands and coronal ridge, prevent phimosis. That is the tightening of the foreskin, which causes predisposition to infection and discomfort with penetration. Prevents infection of the glands called balanitis and reduces the risk of penile cancer in men and cervical cancer in his sexual partner. That means that we can cause the cervical cancer through the skin. Reduces the risk of HIV infection, AIDS. According to the WHO, male circumcision reduces the chance that a male becomes infected with HIV during sexual heterosexual sex by 6%. However, it is worth mentioning that circumcision does not protect the woman against HIV and only protects the man partially. It therefore cannot be considered a prevention method in itself. Okay, disadvantages of circumcision. Unprotected glands. The glands in one of the most sensitive areas of the body. You see, the glands is one of the most sensitive areas in the body. Those who defend the practice of circumcision only when needed argue that the glands needs the protection. This mosquito is doing me wonders here. The glands in one of the most sensitive areas of the body. Those who defend the practice of circumcision only when needed argue that the glands needs the protection of the foreskin. The foreskin is to the glands as the eyelid is to the eye. You see? But I remember the Bible. God said, God put circumcision for a sign of remembrance and oath, you see. So since the ages, it has been practiced among the communities that worship Jehovah God. So me as a believer, I believe that it's supposed to be done. Decreased circumcision, the disadvantage, decreased sensitivity, permanently exposing the delicate skin around the glands, reducing sensitivity. However, it must be noted that the decrease does not affect sexual pleasure, which is produced in the brain by a combination of sensation and not just by stimulation of the glands, you see. Surgical complication. Although rare, there can be complications after circumcision, including bleeding, infection, hematoma, and sexual rejection. So the decision to perform a circumcision on a baby boy should be under medical advice. According to some groups, they are ethical, yeah. So those are how to care for the male genitalia. Testicular self-examination. Just as women should periodically examine their breasts, men should also examine their testicles for abnormalities from time to time, you see. Okay, we are being advised that we should be checking our testicles for abnormalities. Yeah, in each early stages, testicular cancer is not painful and does not cause any symptoms. Therefore, the only way to detect it early is to palpate the testicles in search of any lumps. A shower is recommended beforehand so that scrotum skin is soft and clean, you see. So you palpate the testicles just a little bit. I will have shown you. You palpate the testicles to search for the lumps if there's any, so that to check if there's abnormalities early enough, you see. So gently palpate each testicle between the thumb and forefinger, looking for any lump or abnormality. You just feel it. Okay, caring for the prostate. The main goals are prevention of prostate cancer and keeping the size from enlarging enough to make urination difficult. The most uncomfortable symptoms of age-related benign prostate hypertrophy are those related to urination, difficulty urination, and frequency of urination. The following advice helps urination and relieves the symptoms of hypertrophied prostate. Maintain regular and safe sexual activity. You see, maintain regular and safe sexual activity. Ejaculation helps reduce prostate inflammation. You see, okay. They have said we should maintain regular and safe sexual activity. You see, it reduces prostate inflammation. Does reduce prostate cancer. Okay, like I said, at this life we should take our health, our responsibility, and if given a chance to gamble, we should not gamble with our health, because we are living to protect us from dying. We are living to live. We are struggling to live. The money we are fighting to have is for us to live better lives and for our kids and family, you see. So gambling with our health is not a good idea. So when you hear something about health that can help, you should take care and see how you can go about it, you see. So these lessons that we speak helps, and in any way that in any way you can come across them, don't ignore them, you see. Even if maybe you are not suffering now, But maybe in future or some other time, you can come across something that maybe it's not normal. But these lessons can jiggle your mind, and you can find a solution very fast that can help you. So today we are looking about the male genitalia, and we have found out that meat and milk uh, promote prostate cancer. We have found out that we should mostly check our prostate, our testicles, to see if there's a lump, to avoid prostate cancer, any abnormalities, to avoid any prostate cancer that may come across, you see. So in life, we should be keen with anything that affects us and anything that can help us through life. You see, I've come to realize that positivity, we should be positive in everything, and we should not be ignorant, because ignorance kills. Don't ignore anything, especially health-wise. And the more we do that, the healthy life we will live, both us and our families, because we will direct them to live health-wise. So maintain regular and safe sexual activity. Ejaculation helps reduce prostate inflammation. Decrease or eliminate intake of caffeine, which is present in drinks such as coffee, tea, yerba mate, and certain soft drinks. Caffeine narrows the neck of the bladder, making it difficult for urine to pass through it. Decrease or eliminate alcoholic beverages, which have a similar effect to that of caffeine. You see? Yeah, so avoid nasal decongestants and antihistamines, which relax bladder muscles and make urination difficult, you see. Avoid cold temperatures as they promote urinary retention. Avoid strandling, such as with horseback and bicycle riding. It causes congestion of the prostate. Avoid constipation. Avoid stress as it affects the urinary reflex. Take medicinal herb preparations for the prostate, such as Sabal cerulata or Sopalmato. Okay, let's talk about prostate cancer prevention. Prostate cancer is the most common malignant tumor in non-smoking men. Have you got something? Prostate cancer is the most common malignant tumor in non-smoking men. Yeah. The many epidemiological studies performed suggest that prostate cancer can be prevented by the following 4 factors: diet, pesticides, vasectomy, sorry. Can be prevented by the following 4 factors: diet, pesticides, and vasectomy. Yeah, 3 factors, I think. So if you want to fight prostate cancer, you should this is the more diet you should look. You should check your diet. This is the most influential factor both in prevention and advancement. You see, risk 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 increases red meat and processed meat, such as bacon, milk, cheese, and dairy products in general. You see, we should check our diets to prevent prostate cancer. So risk reduces. If you want to reduce prostate cancer, those are tomato sauce, tomatoes, and watermelon. So men should regularly eat tomato sauce, tomatoes, and watermelon due to their high lycopene content. Broccoli, cabbage, radishes, and other crucifer family plants. Omega-3 fatty acids, vitamin D and E, and selenol. Pesticides, occupational exposure to pesticides, such as in farm workers, increase the risk of prostate cancer. So we should avoid pesticides as much as possible. Okay, vasectomy. After much scientific controversy, a recent study by Fred Hutchinson Cancer Research Center in Seattle, Washington, United States, has not found any link between vasectomy and the risk of prostate cancer. So, foods that we can eat to fight prostate cancer. The foods that we can eat to fight prostate cancer are like tomato. So men should use tomato to fight prostate cancer. It's natural red colorant, lycopene. It's powerful antioxidant that protects against prostate cancer. So it's suggested that we should frequently eat tomato for prostate cancer. Okay, we should eat also nuts. This provide polysaturated fatty acids, vitamin E and zinc, which are all beneficial nutrients for the prostate. You see? Okay, we should eat squash seeds for the prostate cancer. We should eat soy for the prostate cancer. They say that squash seeds reduce inflammation of the prostate and make urination easier. Soy, thanks to the mild estrogenic action of the isoflavones that it contains, soy stops excessive enlargement of the prostate and protects against degeneration into cancer. Soybeans, soy milk, or soy drinks, and tofu are the best natural sources of inflavomes. Okay, these three are the foods that protect us from prostate cancer. Okay, hot stream water. Hot stream of water over the pelvic area. The hot stream of water from the shower over the pelvic area often helps to start urine flow and empty the bladder when urination is difficult. You see? Vital bath. The vital bath is a variant of the pelvic sitz bath. It reduces prostate inflammation and improves urination. See more details, okay? So we have found out that hot water, hot bath helps in prostate cancer. We have seen that the food that helps us in prostate cancer are tomato, squash seeds, and soy. Soy drinks, soybeans, soy milk, and and squash seeds. They help us in a fight prostate cancer. Those are the foods that help us fight prostate. So men should eat tomatoes in a in a large periodically. We should eat tomato. It helps in fighting prostate cancer, and we should avoid pesticides, and we should do vasectomy. Does not It's not a negative. It's not a negative thing, and it's not a positive thing. So you should. It's not a risk factor of prostate cancer. Okay, like I said, the male genitalia organs are designed to produce reproductive cells and deposit them as close as possible to the female ovum. You see, and we found out that the female genitalia is acidic in nature, and that's why we produce seminal fluid to go and neutralize the acid so that the sperm travel through. We found out that the sperm cannot go through the acidity, so the male must produce seminal fluid to go and neutralize the acidity nature of the female genitalia, the vagina. So, and we found out that we should keep hygiene, a good hygiene, to fight the prostate cancer. We should palpate our testicles here now and then to find out if there are lumps that might sound abnormality. You see. So let's check about the heart. Let's go to the heart. You see. The heart. Let's look about the heart. The heart, never-ending rhythm beat stays with humans throughout their entire lives, beginning long before birth, starting on day 23 of intrauterine life. The heart begins to beat. So by the moment of birth, it has already beaten more than 40 million times. You see, the heart is much more than a muscle. It is truly a super muscle made of a special type of a special type is made. It is truly a super muscle made of special type of contracting fibers that can work continuously and with hardly any rest over an entire lifetime. You see, this ability differentiates the heart from the rest of the body's muscles, which need to rest after exercise. You see, the body's muscles need to rest after exercise, but the heart does not. In order to beat without resting throughout life, the heart requires a constant blood supply for itself. This blood comes by way of the coronary arteries, which are the first branches exiting the body's greatest pipeline, the aorta. So you see, the heart needs to beat our entire life. It's different from the bodily muscles that need to rest after the day's activities. You see, the heart needs to be beating 24/7 for without resting, you see. And they said that between the 23rd day of the pregnancy till its birth, the heart of a baby beats 40 million times before birth, you see. So that shows that that's the only organ that never stops working. Okay, caring for the heart involves more than anything. Keeping coronary arteries clear to ensure blood can flow through them and supply the blood that the heart demands in order to perform its work. Okay, so to develop a healthy body, it is essential to know how to take care of the heart. You see, to develop a healthy body, we should know how to take care of the heart. So caring for the heart, it involves modern medicine. Medicine is capable of saving 90% of patients who arrive at the emergency room with the myocardial infarction, but it cannot prevent it from happening. This depends on personal habits. Okay, the personal habits that we do in our daily lives are the personal habits that we do in our daily lives are smoking. You see, we smoke. Do not tobacco narrows arteries. Tobacco narrows arteries and decreases blood flow to the myocardium, the heart muscle. You see, any amount of cigarettes is harmful to the heart. You see, any amount of cigarettes is harmful to the heart. So we should not smoke for the healthy heart. We should not smoke. See, okay. So we should control. Number two, we should control blood pressure. We should control blood pressure. All adults should measure their blood pressure at least once per year. A reading greater than 140 to 90 of mercury requires corrective measures and possibly treatment. Excessive pressure levels damage the heart. Okay, we find out that exercise, keeping the heart in good condition, requires at least 30 minutes of vigorous exercise per day. You see, every day we should have at least 30 minutes of vigorous exercise. Do you know why we say vigorous? Because it's not just a small exercise like walking or something, but a vigorous exercise. Vigorous exercise makes the heart healthy, you see. So we should at least have 30 minutes every day of vigorous exercise for a healthy heart. Or 40 minutes 3 times per week. 40 minutes 3 times per week. Vigorous exercise is exercise that causes perspiration. You see, with physical activity, the branches of the coronary arteries open up, and the heart muscle receives better blood flow. You see, so we should have 30 minutes of vigorous exercise every day. Vigorous exercise, 30 minutes, you know. You can do it in your house or go to the gym. So you can do 5 press ups, you can do 20 sit ups, you see. You can do some jumping, but it should be vigorous exercise. You can do it at home or go to the gym, or you can do some jogging somewhere for 30 minutes, exactly 30 minutes for a good heart. And we have found out that a good heart is a good life. So if you want the most heart healthy exercise is walking at a vigorous pace. You see, very easy. You see, very easy. The most heart healthy exercise. The most heart healthy exercise is a walking at a vigorous pace. Just walking. You just walk at a vigorous pace. Just instead of booking a bus or a motorcycle going somewhere, just get out, start walking vigorously. That's an exercise, you see, for your heart, for your healthy heart. Just walk vigorously for about 30 minutes continuously. Don't walk for 10, 10, 10. No, for about 30 minutes, just walk vigorously. Just walk vigorously going somewhere. You can go somewhere and come back walking vigorously. Or you just go jogging, or you just do some push-ups. Okay, we all have 2 doctors, the left leg and the right leg. You see, we have 2 doctors for the heart, the left leg and the right leg. So make them just treat you well for your heart, to for a healthy heart. Heart healthily eating, low in saturated fats. Always, fats are our main enemies for the heart. Low in saturated fats, low salt, low sugar, and no meat. No meat. You see, for a healthy heart, no meat. Low salt, low sugar, low fat. Fresh fruits and vegetables, nuts, whole grains, and olive oil are especially beneficial for the heart. Okay, although some statistics studies have not found a clear relationship between coffee intake and coronary disease, experiments have shown that mainly due to its caffeine content, coffee has the following negative effects on cardiovascular health. It increases blood pressure slightly. It increases blood adrenaline levels. It promotes hardening of the arteries and makes dilation more difficult. It increases cholesterol levels and homocysteine in the blood. You see, coffee intake triggers coronary events in sensitive people and also increases the seriousness of the cardiac infarction. This means certain people have greater hereditary predisposition of eliminate caffeine slowly. Okay. An extensive study shows listening to music has favorable effect to the heart. It decreases blood pressure and heart rate. So listening to music is advantage number 1 of to the heart. So when you listen to music, it decreases blood pressure and the heart rate. It reduces anxiety and pain in heart patients, you see. So music is good. Listening to music for the heart is okay and is being advised. Not just any type of music, though, is beneficial for the heart, but rather the kind with these 3 characteristics, you see. So not every music is good for the heart, but with the music with a pleasant melody, little rhythm, you see, and a lot of harmony. So music that we should listen to for the heart are music that has a pleasant melody, a little rhythm, and a lot of harmony. Ideally, the music listening sessions should last half an hour, you see, not always like the whole day, and be directed by a music therapy professional. Okay, listening to music should be half an hour, not like throughout the day. Okay, natural treatments for the heart are cold compresses over the heart. You take a towel or an handkerchief, you put in cold water, and you place in the chest. A cold compress applied over the heart relieves anxiety and stop tachycardia. It also achieves good results in arrhythmia. Hot compresses over the heart. Also, you take a piece of handkerchief or a towel, put in hot or warm water, and then you place on your chest. You see, it helps. Okay, hot bath for the arms. Due to a reflex mechanism, heat on the arms has a vasodilation effect on the heart and chest arteries. You see, you take your hands, you place it inside warm water for some times. Indication: hypertension, angina, and heart failure. Place both hands, plate, place both arms into the bath at the same time. You see, just like this. It helps in the it helps in hypertension and heart failure. Okay, it is not clear, as some said, whether wine consumption improves cardiovascular health or prevents heart attack. After a few decades of statistical enthusiasm over the reported health effects of moderate consumption of wine, alcoholic beverages, from which the industry has financially benefited in recent years, more realistic studies have shown the many undesirable effects of wine and alcohol on health. The following can be understood from these recent studies. The positive evaluation of wine and alcoholic beverages on overall health is primarily a response to a cultural and economic factors more than to a contrasting scientific data. You see, low alcohol consumption, like less than 30 grams per day, which is equivalent to 150 milliliters of glasses of wine, 2 glasses of beer, or a glass of liquor, has the following undesirable effects. It increases the risk of breast, liver, mouth, throat, and esophageal cancer. You see, the wine, among others, according to the study of over 1 million women at the United States National Cancer Institute, it promotes hypertension. It causes predisposition of heavier drinking, along with its corresponding effects. No alcoholic beverage, including wine, can be considered a therapeutic remedy. Nobody who is abstaining from alcohol should be encouraged to drink in order to improve cardiovascular health as a remedy, as recommended by the WHO. In fact, all drinkers should be encouraged to reduce alcohol consumption. 5 simple recommendations that can save many hearts, you see. So eat fewer fats and better quality fats. Fats are our main enemies, the heart enemies. The diet needs to supply a certain amount of fat, which should not exceed 30% of total calories consumed. For 1,000-calorie diet, this means 67 grams of fat, a little more than 4 tablespoons of oil. The typical Western diet is high in fat, up to 45% of total calories intake, being primarily saturated fats from meat and milk. This fat is also accompanied by cholesterol and promotes the production of more cholesterol in the body. An excess of fat, cholesterol becomes deposited on the walls of the coronary arteries, feeding the heart, reducing the amount of blood it receives and weakening it. When the blockage of coronary artery is significant, the result is a heart attack. You see? So we have found out that the heart, we should avoid fats, we should avoid alcohol, and then we should avoid smoke. Smoke is an enemy of the heart. And then we found out that we should avoid coffee and caffeinated beverages. And then we found out that we should do exercise at least 30 minutes. Oh, excuse me. At least 30 minutes per day. So that's how we should save our hearts. And we said that walking is a good exercise to the heart. Okay, they say that we should eat less salt due to its sodium content. Excessive salt in the diet hardens arterial walls and promotes hypertension, which overburdens the heart. So the goals to when we use less salt, we reduce or eliminate consumption of processed, canned, and high salt foods. Reduce salt intake in less than 6 grams per day. Okay, eat less sugar. Sugar is also our enemy here. Sugar in the diet is converted to fat and increases blood triglyceride levels, all of which promotes blockage of coronary arteries, feeding the heart muscles, you see. So our enemy, we should try as much as possible to make sure that the blood runs to the heart. You see, anything that may block the blood from running to the heart is our enemy. We should fight as much as possible to keep the blood, more of it, run to the heart, because the heart needs the blood to beat continuously. You see, it should not stop, and it will never stop until the day we die. It will beat like 24/7 since the 23rd day. Okay, we should eat less meat to help the heart. Meat, especially red meat, beef, lamb, and pork, is harmful for the heart due to the following reasons. It contains saturated fat and cholesterol that clog the arteries. I told you that we should maintain the blood flow to the heart for a better heart. That's why we do exercise every day to reduce to help the heart receive blood. Heme iron is in meat is absorbed better than the non-heme iron in vegetables. However, the iron in meat damages coronary arteries, and with higher consumption of meat, the risk of heart attack increases. You see, its proteins generate acid residue that promote atherosclerosis in coronary arteries. Okay, it contains okay, what we have found out that we should avoid meat, more of it, especially red meat. We should avoid sugar, more of it. We should use less salt. Okay, we should eat fewer fats, and we should avoid smoke. We should use compresses, both hot and cold. Place it on our chest, and we should avoid alcohol. We should do exercise at least 30 minutes to 40 minutes per day. And the best exercise for the heart is walking. You see, we should control blood pressure. We should avoid caffeine. Those are the remedies for the heart. Okay, food and nutrients for the heart. Food and nutrients for the heart. Nutrient supplements have beneficial effects for the heart, but do not replace the need to eat a healthy diet. You see? Eating all grain improves artery condition and prevents atherosclerosis, as shown by a study. Okay, a whole grain is complete just as nature provides it. Due to this, it has two parts that are very rich in cardioprotective nutrients, which are not present in refined flour. You see, the germ, rich in poly, polyunsaturated fatty acids and vitamins E. The bran, which has high concentration of fiber, vitamins, minerals, and antioxidant phytonutrients in cow's milk. Okay, these are the foods for the heart. There's a broccoli, papaya seeds, there's a red currants, and there's a pumpkin and sunflower. They are good for the heart. They are like soy, the nutrition committee of the America. Okay, cow's milk is not advisable because it has so many lactose. Okay, guys, that's it for today. That's it for today. I was just to come here and greet you and have a lesson, and that's where we'll stop for today. It's about 1 hour. Unless someone has a question, I will gladly answer. Thank you so much for coming to my live. Thank you so much because of you. I'm here because of you. Yeah, so thank you so much. Kindly, where are you watching from? Me, I'm streaming from Kenya. I'm streaming from Kenya. Where are you watching from? Where are you watching from? Kindly tap the screen. There's a mosquito is biting me. Yeah. So this channel, I've just changed my niche. I was doing comedy, but I changed my niche just recently. So if you find me doing health lives and posting health videos, it's because I changed my niche. And the reason is I I moved from where I used to stay. That's one. Two, I was at a point I was embarrassed in front of my kids. They were watching my videos, and I was looking at their faces. They were a little bit disappointed because of the things I was doing. They were. It's like they were wondering what kind of things I'm doing. It's like they are, they were not proud of me doing that. So I had to change, because I imagine if they were disappointed of how I was doing my comedy videos, then maybe some of my viewers also, some of my content was not okay. So I had to change. So right now I'm doing a healthy content. I've changed my niche, and I pray to God to guide me and bring me subscribers, my family that I'll go on with through this journey. But I've come to realize, I've come to learn that everything is possible, and there's a reason for everything. Uh, Me doing that has slowed my views. I hardly get 1,000, or I hardly even get 500 views. But it's okay. I know one day, one time, it will pick up again, because I'm a hard worker. Right now, I'm fighting to get 1,000. I'm fighting to get 1,000 hours, so that I see if I'll be able to monetize. Yeah, that's it. Just give me a minute. I do something. Yeah, so that I see if I'll be able to monetize. You see, monetization is not easy. It's not as easy as I used to think it is. So we work hard for it. Welcome guys, welcome. How are you doing? Ana, sasa kidogo 5 minutes kama bado hujaseta. Itabidi nitafute pesa nilipe. Ndio. Ndio. Nikuje. People are just coming and rushing out. Huh? Mm. Maze unlike nakwambia maze YouTube lives eti lakini nafikiria ni like ukistart kwenda live YouTube so much because there's no hello, how are you doing, where are you watching from, I'm streaming from Kenya. Thank you so much, Mohammed. Thank you so much. How is London? Thank you so much for joining my live. I'm streaming from My microphone is off. I'm streaming from Kenya, Siaya. Yeah, I'm streaming from Kenya, Siaya. Thank you so much. Thank you so much. I'm at Lagos, Siaya, the land where we produced Barack Obama. If you know Barack Obama, yeah, that's how I can tell about this area. Ikizima mpaka ameenda shwari, inaonekananga lakini sasa green mpaka ameenda guy. So like I was saying, I sometimes I don't understand YouTube, but finally I know I will, because I'm dedicated to. It's so hard, I can say, but with hard work it's possible, and dedication, because life generally is not easy, and anything is possible. YouTube itself is a platform that it gives us a chance to show what we can do to the world, but very few keep up, because it's not an easy work, you see. So for me, that's my dream, to be a content creator, and I hope that one of these fine days I'll be monetized, and do it as my job, you see. Yeah. Well, hello, where are you watching from? Where are you watching from? Where are you watching from? Tap the screen, tap the screen. Tap the screen. Tap the screen. You know, well, but I like this nini. You know what I can say, YouTube prepares you first. Si ndio? Inakuprepare kwanza because haikupei watu mara moja. Unaona? Kwanza inakuacha tu kwanza unaongeanga tu peke yako, alafu inaanza kuintroduce mtu mmoja wawili. Unaona? Unaanza kuongea nao because wakikuja wengi utashtuka, si ndio? Sasa unaona tu mtu mmoja amekuja from London na nimefumble. Unajua ameniuliza nini? What do you do with yourself? Alikuwa anamaanisha alikuwa anasema anawatch from London, where in Kenya. Nikamwelezea though siko nasikia, haiko nasikika. Akaniambia no problem, glad to see you. I can't hear you. Now I can hear you. Sasa vile nimechange mic, akasema what do you do with yourself? Unaona? So assume there are 5 people. They ask you question and yeah. So assume there are 5 people and they're asking you questions and you are supposed to respond. Okay. Now assume there are 20. So YouTube prepares you first. Lakini sasa ile time ukianza you are still new. Bado hujaunda ile community. So inakuprepare kwanza. Inakupea 3. Kwanza vile anaingia vile anaanza kuuliza maswali kwanza anakusikia. Unaona? Kama hujazoea. It's normal. Well, manze, it's hard. It's not easy. It's hard. Kwanza tu yani anakuuliza swali and then you start to fumble. Unaona? Unaweza kumwambia manze, I'm sorry. This is a mistake. Unaweza kumwambia nini, I'm sorry. This is a mistake. Please just go away. Because hujazoea. Hello guys. How are you doing? Where are you watching from? Kindly tap the screen. Where are you watching from? I'm streaming from Kenya. I'm streaming from Siaya, Kenya. Where are you watching from? Hey. Mazee is hard. YouTube is hard. It's not a joke. YouTube is not a joke. Wale wenye wanataka kuwa ma content creator. Hello guys. Where are you watching from? Where are you watching from? Tap the screen. Tap the screen. Give me some likes. Give me some likes, guys. Give me some likes. I want us to go back to our lessons. I want us to go back to our lessons. I want us to go back to our lessons, but first tap the screen. Tap the screen. Give me some likes, guys. Give me some likes. Nakwambia. And then unansikia mmelala. So it's not easy, man. YouTube is not easy. It's not a child's play. YouTube kitu ya kwanza inafaa ukuwe na courage. Kitu ya kwanza inafaa, kitu ya pili ukuwe na charisma. Kitu ya tatu ukuwe na you must have things to say, and you must have like courage to just go live. It's not a joke. It's not a joke. It's not a joke. Even mtu akikwambia ati analipwa na YouTube, it's not a child's play. Sikudanganya. Mtu akienda kubrag kwa watu no, ama nini, ama you see, I'm a content creator. It's not a joke. It's not a joke. Getting paid with YouTube is not a joke. That's what I can say. It's not a child's play. You must work for it. Just mimi nilikuwa nafikirianga kitambo that YouTube, as long as ushafika 1000, kwanza kuna mwenye aliniambia YouTube alidanganya sana. Ukishafika 1000 subscribers unaanza kulipwa na 3000 hours. Wewe, it's not just like that. You must push yourself. Yani it's a lot of things. YouTube is not just 1000 subscribers and 3000 watch hours and unaanza kulipwa. No, it's a lot of things. Ni vitu mingi sana involved. You must have a community. You must have friends. You must have like lazima ukuwe na talent. Unaona? Content creation pia ni talent. Content creation pia ni talent. Nothing is ever easy. Hiyo kitu nimerealize. And then kuna kitu nilikuwa nafikiria. Saizi, what am I doing right now? Saizi niko nang'ang'ana kutafuta pesa. I'm working hard to get some money, ndio? And what's the purpose? I'm working hard to get some money to be successful or richer. And then to me, I'm a believer, and assume I'm now there financially comfortable. What will I do? Like now I'm there. What will I do? Because what will be my next step from being successful? Now I'm rich, I have money, and then what? You see, now I'll be now looking for God, I can say, or I go now to I get saved after now I'm rich, or should I be rich? Or should I get saved first and then get rich? Should I get rich first or get saved, or both? Wanza sema nini? Then rich, because ukikuwa tajiri, let's say make it in life, ndio? Alafu ukienda church wanakuambia now, Mungu anakuambia now go sell your things, give them to the poor and come follow me. You see? Na umefanya kazi, umework ndio upate hiyo pesa, unaona? So ni kama plus and minus. So unapatanga mtu anakuambia mazisa is tiresome, like umefanya kazi, umepata pesa, alafu Mungu anakuambia Now go sell them to the poor. Go give them to the poor, and come and follow me. Unaona, for you to have the for you to have to be sure of the kingdom of God, unaona. So mazee ni hard. Unapata wasi wanasukuma. So mtu kama sasa mimi nasema ati nikuwe rich kwanza ndo nianze kwenda church kila siku, unaona. So unang'ang'ana unakuwa rich. That's how after umekuwa rich unaanza kwenda church, and then so ukienda church wanakuambia now give to the poor, sell everything you have, or sell take your properties, whatever you have uko nayo, let's give them to the poor, you see, for us to have the kingdom of God. So anyway, me I'm a believer, and I believe that Mungu akona reason ya everything, and Mungu ndo wanga anatupea utajiri. God makes us wealthier. God makes us rich, and God akona sababu. That's why Abraham was rich, and Abraham was talking to God. Mungu hakumnyang'anya mali. Job was rich, so God is not against being rich. God is not against working hard. We should work hard, get some money, because not working hard entirely is a sin. God said that we should work hard for us to eat. That's why I must work hard as a content creator, so that this channel might be or maybe monetized, you see. So kindly subscribe my channel, tap the screen, give me some like, comment on my videos, support me, brothers, for me to reach 3,000 hours. That's what I can humbly ask you to do. But for real, it's not easy. YouTube is not a child's play. YouTube is not a game. Don't quit your job saying that I'm going to be a content creator. It's not easy. It's not easy. You know, from what I've seen since I started this channel, content creation is not easy. It's not a child's play. It's not a child's play. Content creation needs a talent, dedication, and humility. You must be humble. You must be patient. You know, like everything. So don't see anybody out there telling that he's a content creator. I've made it in content creation. Just take it as a joke. Content creation is not a joke. It's not. It's not. That's what I've come to realize, that you must have a talent, you must have charisma, you must have courage to talk to people, you must have patience to wait, you see. You cannot force things. When you force things, they only get worse. So it needs patience, lots of patience. You must just be patient to get your channel monetized, to get your videos get views. Sometimes you post, you go back to check. You post thinking that this one is a viral video. This one only when you go back to check the video, you find like 50 views and 1 like, and that like is yours. So content creation kama usipokuwa na roho, if you don't have a heart of patience, my friend, content creation is not your thing, because it's a little bit disappointing. You might get disappointed at some point. You can be disappointed, and you can even give up with it. You can just go do some other thing, you see. So if you quit your job to go be a content creator, hey, you have a rough road to ride along, you see. So kindly, if you have a chance to support a content creator like me, kindly do so, because it's not child's play. You see, it's not a child's play. First of all, you must have that courage, you see, to talk and to express yourself and to answer questions. And some people even say like can tell you things that you don't like, you see. But if you don't have that wisdom to say like to stay strong, my friend, content creation is not for you. So anyway, me as I always say that this channel is in a platform that supports, and I have that courage. I have that courage to fight on. You see, to fight this battle till the end. I know one day. You see, I know one day I'll be monetized by this channel, and I'll be proud of myself when I'll be on the other side. You see, they say that grass is greener on the other side. So we are fighting to get monetized, and when we have been monetized, now we'll start feeling like, hey, there's pressure to post, there's pressure to do this, there's pressure to, you see. But for me, I know that that's my goal, to get monetized with this channel, and then yeah, I can be. It will be a milestone to me, because it has been my dream since I started this channel. It has been my dream, my hope. I am hopeful that it will work one of these fine days, you see. So kindly, YouTube, monetize me, monetize my channel. Okay, let's go back to our lessons. These are the foods that let's talk about today. Okay, right now we can talk about prostate and prostate cancer, and how to avoid prostate cancer. We talked about the heart, foods of the heart, that support the heart and fight the heart disease. Babe, kumbe hii broccoli iko na nini mingi sana. Nimeona broccoli kwa nini mingi. Broccoli inasaidia, broccoli na cabbage inasaidia sana. Broccoli na cabbage, broccoli cabbage. Hizi broccoli wanga zinapandwa wapi? Broccoli nizamia huko hivyo chini kadenge kweli. Broccoli then broccoli iko sawa. Broccoli nimeiona sana. Broccoli, according to a study by Tokyo University of Science, eating 70 grams of broccoli florets for 2 months can reduce the bacterial colonization of Helicobacter pylori by 50%. In addition to, as well as other plants in the crucifer family. So, YouTube, I can say it's not a child's play. It's not a child's play. YouTube is not a child's play. YouTube is a serious thing, and YouTube is not a joke. YouTube is a serious thing, and YouTube is not a joke, my friends. YouTube is not a joke. You must be willing to fight the end. And before you come back to your senses, don't just joke around with content creation. If you cannot, don't start. Don't start if you are weak. It's not a weak platform. But if you have that courage to go on, you push and make it, because to me it's not all about the money. To me, it's not all about the money. If I put it that it should pay me, it must pay me, then it won't. It's all about creating a family, a YouTube family that can support and can teach. We can interact. Like I say, supporting is free will, and nobody can tell you that you must subscribe, you must like. No. It's your free will. It's optional. If you like, you can support. And life itself is like that. It's not easy. It's not easy. Yeah, life itself is not easy. Life itself is not easy. Hello, where are you watching from? I'm streaming from Kenya. Where are you watching from? Umelala? Umelala? Hey. Nikushtua na vile nimekuguza tu polepole. Kuchoka. So, like I said, content creation is not a joke. It's not a joke. So whoever wants to be a content creator must be prepared, and John, nilikuwa nakwambia brokoli kumbe inatibu nini mingi sana. Nimeona brokoli kwa lungs, brokoli iko kwa heart, brokoli iko kwa kidneys. Nimeona brokoli sehemu mingi sana. Broccoli iko kwa H. pylori. Broccoli iko kwa nini? Broccoli iko kwa colon. Inasaidia kwa colon. Bem, unalala tena. Sinaona umeweka simu kando. Lipi na utaki kulala? Hello guys, where are you watching from? Where are you watching from? Uko sleepy na utaki kulala wewe. I'm watching you. Mimi hata nimemaliza. Kuna 10 minutes. Niko tu na nini? I only have 10 minutes. Ulikuwa nakwambia nimeona broccoli kwa H. pylori, nimeona broccoli kwa lungs, na nimeona broccoli kwa colon. Kuonja broccoli. Mazee bebe watu wako selfish. Umelala? Watu wako selfish nakwambia. Imagine niko tu na 2 likes. People are so selfish, my friend. But it's okay. Hello, where are you watching from? Ama watu bado wanajua. Hello, where are you watching from? Where are you watching from? Broccoli tena umelala. Broccoli tena inatibu macho, caring for the eye. Kumaanisha broccoli is something tena mwana nini broccoli ina care for depression. Hello guys, where are you watching from? Where are you watching from, my friends? I'm streaming from Kenya, Siaya. Where are you watching from? Broccoli tena neuroprotector sana, nimeona tena kwa brain. Unaona? Neuroprotective effect of lungs. Broccoli tena iko caring for the brain. Okay guys, thank you so much for liking my live. Thank you so much for being with me today. This channel is taking a new niche of health. But initially I was doing comedy, but God willing, I'll be going through the healthy tips to encourage us live healthy and be productive in our daily activities. I thank all my subscribers. Thank you. All those who like my post, thank you. All those who view my videos, thank you. Without you, we can't be here. So we are here for you, and because of you, we post. So you encourage us to do so. God willing, We will be here again tomorrow, and I pray that God Himself enables us to have a good night. If it's day, wherever you are, have a good day. Here in Kenya, it's about 11 in the morning. It's just a quarter to 11 in the evening, at night. It's a quarter to 11 at night. Yeah, here in Kenya. So I'll end my live today at that point. Thank you so much for watching, and may you be blessed with your family. Okay, so thank you so much, and God bless you. We'll be here again tomorrow during the day and at night. Thank you, and God bless you. So I'll end my live at that point. Good night.